All right, well, I'm going to go ahead and get us kicked off this morning. This is our third coffee break with the New Braunfels Chamber. I'm Wes Scudder, chair of the board this year. And this is really an outreach service that Phyllis put together. As we said, how do we communicate in this time of doing a lot of Zooms? And so, our first one was COVID-19 in the workplace, and we had Natalie Ruggie in here, Lilia's partner, to take us through that. Then last week or 2 weeks ago, we had Randy Montagumba from the schools just to give us an update on what's going on in the schools. Today, we've asked Jim Wesson and Mark Bernard, both from the hospitals, to give us an insight on what's happening within the hospitals. And certainly from when we started this a month ago, the scene in the hospitals, at least as COVID goes, is certainly much better. So we're going to give each of them 10 minutes. Before I start, I do want to introduce a couple of the Chamber Exec Committee. They're on the call. First of all, Mike Meek, the CEO of the Chamber, has joined us this morning. Also, Shane Wolf, the immediate past chair, has joined us as well, so thank you for that. In the room with me this morning, running the computers, Phyllis Forrester is here, and Chester Jenke and Stephen Brockman. So, as always, I appreciate the VPs from the Chamber handling the technical part of this. Our first speaker this morning, we're going to give him 10 minutes, is Jim Wesson. Jim is the president of Christus Santa Rosa, as you know. He's going to go through about 10 minutes worth of Christus information, and then Mark Bernard, the CEO of Resolute Health Hospital, will then go through 10 minutes. I would encourage you, go ahead and remain on mute, and we'll try to keep the muting on just to keep outside noise down. If you do have a question, please go ahead and put that in the chat box. And so as we're coming along, if you can think of anything that you want to ask, and then we'll feed that to the presenters as well. We're leaving 10 minutes at the end so that we can have any questions answered. So with that, Jim, I'll go ahead and turn it over to you and tell us what's happening at Christus.
Well, thank you, Wes, and just thank everyone for the opportunity to be with you today. Wes told me that we had 10 minutes, and many of you may know I'm the son of a Baptist preacher, and I remember my dad would always, when he was in the pulpit, would take his watch and lay it down there, and I'm not sure he really ever paid much attention to it by the length of his sermon sometimes, but we'll try to manage our 10 minutes today. I want to tell you a little bit really just about the experience that we've had here at Christus Santa Rosa Hospital over the last 6 months. We'll leave it up to others to pontificate on really what the future may or may not bring, but I wanted to tell you really what we've experienced. And a lot of what you hear from me will be very redundant, I think, with what you hear from Mark. And that really was intentional and by design. Because even though that Christus and Resolute are both part of larger healthcare systems, Mark and I worked very intentionally and tried to stay very close, and we're in contact often to make sure that we were doing things that were consistent, really just to avoid confusion in our community. Because we knew that if Resolute was doing something one way and Christus was doing another, that could create that confusion. And so Mark and I really tried to track along together to create that community standard. We text each other every morning with the volumes that we had in our hospital, and he would do the same. We actually included the San Marcos Hospital and Seguin Hospital as well. But 7 days a week, 5:30 or 6 in the morning, I'd get a text from Mark, and he would from me, and on the volumes that we were experiencing. As I said, we are part of larger systems, and I will tell you that being part of a large system for Christus certainly was a tremendous benefit to us during these last 6 months. We had a lot of dedicated people at our system office, at the system level, that were working continuously to support us here in New Braunfels in sourcing PPE and sourcing ventilators, testing kits, all types of supplies. We had experts in infection prevention. We had experts in testing protocols. And so it was a tremendous benefit for us to have that system resources. I will tell you that throughout the pandemic, we did maintain adequate supplies of PPE. We had adequate supplies of ventilators. We really had adequate supplies of gowns, everything we needed. We were able to maintain adequate supplies of testing kits. That got a little sketchy at times. Test kits were not always available. They were oftentimes being allocated to us. And so that would get sketchy at times, but for the most part, we were able to maintain everything that we needed. We were not a primary testing site, and that was confusing for people at times. I would get questions on that. People would think that they could just come up here to our ER and be tested, but we really were not a primary testing site for a couple of reasons. One, we did not want to just overwhelm our ER with patients who were coming in just to see if they have COVID. And we didn't want to overwhelm the hospital with a lot of people who had COVID. So if someone did not need to be admitted to the hospital, we referred them to other places to have the outpatient testing. We'd refer them back to the county testing site or to their primary care physician's office or to a prompt to or one of those areas. We really reserved the testing for our inpatients, and we did that for a couple of reasons. One, it was very important for us to be able to manage the placement of our patients, for us to know if someone tested positive for COVID or not. And so we wanted to make sure we maintained that adequate supply here so we can manage the patient placement. And that also helped us be good stewards of our PPE as well, because finding out as early as possible if someone actually was positive for COVID or not made a difference in the use of our PPE. Early in the pandemic, many of you probably know that we were sending all of our patients to San Antonio. If we had a positive patient, we would send that positive COVID patient to San Antonio. But in July, when the San Antonio hospitals really began to be overwhelmed, we had to start taking and keeping the patients from our community here locally in our hospital that were positive COVID. And so that caused us to really have to do a number of things. We had to create a dedicated isolated COVID unit. We had to expand our ICU capacity. We then had to create a number of what are always private rooms. We had to convert them to semi-private rooms to give us the bed capacity to take care of the number of COVID patients that we had. We then began to limit our visitors. We went to a no visitor policy. We had to restrict access points. We began to screen everyone that came into our facility. We went to universal masking. We had nurses come in from all around the country, from different states, many with a lot of experience in treating COVID patients that supplemented our staff. We had to obtain additional ventilators. So a number of things that we did. The governor then restricted the elective procedures that could be done in our hospital, so that impacted us as well. Now, I want to address one thing, Wes, if I can, on that, because there are a lot of people out there who you'll hear sometimes believe that hospitals are really benefiting from COVID and from taking care of these patients. And I can tell you with certainty that this is it's not a money-making strategy for hospitals by any means. And if it were, it'd be a bad one. While there is, as you may know, some increased reimbursement that we do see from the payers, from the federal government for taking care of COVID patients, that little increase that we see is well offset by the cost of care that it takes to take care of the COVID patients. The length of stay for these patients is much longer than a typical length of stay, especially if they end up in the ICU, so very long length of stay. So the cost of care is very high. That, coupled with the decrease that we've seen in elective procedures, some of that mandated by the governor and some of it just people self-selecting to wait and have their procedure done later. That decline in elective procedures, in addition to the cost of care to take care of COVID patients, has really made this a challenge. We don't have time today to get into all how healthcare financing and accounting is so different really than any other kind of accounting that you ever see, because we work with so many different payer sources. But I can let it suffice to say that this is not a profit-making motive for us to be going through this pandemic. I will tell you, though, and it's important for everybody to know that really throughout all of this, we've maintained a very safe environment. At the peak back in July, we had 29 positive patients here in-house. We are down to 1 today. So we are seeing the trends certainly go the right way. We have now relaxed our visitor policies. We've opened up those restricted access points. And we do continue to screen, and we continue to have universal masking in our facility. But we've been able to do a number of things that are getting back to a little bit more of a normal. We really want to encourage people not to delay or defer care, though out of fear of coming to the hospital and fear of being exposed to COVID. We've worked hard to maintain a safe environment. We know that sometimes delaying or deferring care causes people's conditions to worsen, and what may have been just a simple laparoscopic removal of a gallbladder can turn into something much worse. Or if somebody's having chest pain and they don't come to the ER because they're wanting to avoid COVID, then they could end up dying of a heart attack or stroke or any of those things. And so we would like people to keep that in mind and continue to come to the hospital when they need us. Last thing I would like to say, I guess, finally, from our point of view, before I turn it over to Mark, is that I really want to say how much and how proud I am of our staff. They have just done a tremendous job over these last 6 months. While many people were kind of hunkering down and staying home, our team really continued to show up every day, suit up in their PPE, which oftentimes makes it difficult to work. And they worked hard every day and did an outstanding job. And so as the administrator of the hospital, I just can't tell you how proud I am of them and the work that they did. I also want to say, Wes, that I'm really appreciative of the leadership that so many in our community showed. Dr. Overman at the county, Mayor Brockman, Judge Krause, others. I know our school superintendents, many of them had to make hard decisions, difficult decisions, and I know had a lot of opinions about those decisions that were made early on in this. But I can tell you that the decisions that were made really helped us maintain availability in our hospital, kept us from being overwhelmed, and allowed us to be able to continue to take care of non-COVID patients, those that were having heart attacks and strokes and other things that brought them in that were not related to COVID. And so we appreciate so much. We don't believe we're out of the woods yet. Again, we've got one today, but we are still making sure we're in a position that if we do see an additional surge, that we want to be able to take care of those patients. And so we're staying prepared. So we would encourage everybody to continue to wear a mask, continue to socially distance as appropriate, wash your hands, and get a flu shot. We really believe that getting your flu shot early this year will potentially have some impact on any potential surges that we might see again with volumes in the fall. With that, I will turn it over to my good friend, Mr. Bernard, and let him tell you how things have gone at Resolute. Thank you, Wes.
Wes, I think he left me about 5 minutes. He is the son of a preacher, clearly. So just by way of quick background, Resolute's been open 6 years. We're part of the Baptist Health System. We're owned by Tenet Health Corporation, based out of Dallas, Texas. I've lived here 10 years and been at Resolute for 4. Kind of a quick history or brief history of our experience with the pandemic that started in March. We saw our volumes and our financial performance really go from great to marginal in just a couple of weeks. Much of that ignited by 2 things. One, Governor Abbott's executive order on March 22nd, and really the very public in terms of media events that were going on in New York City. We saw inpatient volumes drop to lows comparable 3 to 4 years ago. Physician practices were seeing 30 to 40% of their typical volumes. We closed one of our nursing units. We consolidated resources. We furloughed some staff. We suspended capital expenditures. We really curtailed as many expenses as we could just because we were very fearful of our financial viability in the short term. We told our volunteers to stay home. We enforced a masking policy on all healthcare providers. We changed our visiting policy. Our vendor shut down the gift shop. We started screening anybody that presented to the hospital or really entered our building. Staff were scared, as much of the public that we serve. And we were pretty anxious about our PP inventory, our personal protective equipment inventory, just because of what you were seeing on in the media. But the excitement and the anxiety were really unknown because there were very few COVID positive patients at the hospital at that time. Like Christus, we initially thought as a healthcare system that we would cohort all of these COVID positive patients at one hospital, and that lasted a relatively short period of time. I can tell you when this all started, we had 0 COVID patients in the beginning of April. We had very few in May. The pandemic for us really did not hit until June, with the peak in mid-July where Resolute would have a high of 35 COVID patients hospitalized. The entire Baptist system had about 355. For us, it was about 45% of our volume at that time. So how were the last 5 months? They were trying, but we survived operationally and financially. Our staff have been remarkable. Our inventory of PPE was never compromised, but we had a few scares. We were monitoring close enough where we knew what we would have until next Tuesday unless a shipment came in. We managed through a crisis, and there are always some valuable lessons learned. We've grown as a management team, really had some remarkable clinical outcomes, some great success stories, but they certainly don't overshadow the loss of lives. And some of those deaths were unrelated to COVID. We had patients sitting on healthcare issues, kind of mentioned like Jim, for example, lingering chest pain that was actually a heart attack and that ultimately resulted in a death. As mentioned by Jim, dialogues or relationships with other healthcare facilities became more frequent and certainly improved. During the course of this time, it's exciting to share that we had 5 new physicians join our medical community that I can think of, and Jim might want to add to it. We've had Dr. Jason Bradford, an obstetrician, Dr. Wellaway, an orthopedist, Dr. McLean, a general surgeon, Dr. Graby, an obstetrician, and Dr. Mustafa, who's an endocrinologist. Where we're at today, we have 5 COVID patients in-house. I would say for the last 2 or 3 weeks, we've had single digits in the facility. It's about 8% of our volume, so much different than the 45% that I'd mentioned before. We're still screening staff, patients, and visitors. We're testing all procedural patients that present to the hospital, for example, surgical patients. We're allowing 1 visitor per patient. Some of our volunteers have returned. Our gift shop is open once again. Many of the furloughed staff have returned. Volumes are about normal to what we expected, except in our emergency department, we're seeing volumes run about probably 80 to 90% of what they did a year ago. Our financial performance has improved. We're reinvesting in capital commitment and certainly remain committed to clinical excellence and the patient experience. And I think the strong message that I would share with this audience, just to echo what Jim said, is the hospital's a safe place, perhaps the safest place you can be. We have hand hygiene down to a science and remain committed to those that we serve. So thank you.
Great. Okay, thank you. And Mark and Jim, great recap of what's happening here. And I hear exactly what you're saying. I know I've got some coworkers that had put off doing elective surgeries, and now they've done them, and it's time. It's just time to continue to move forward. So I think those are really wise words. We have a question from the chat. It says, do the hospitals in Comal County have access to remdesivir and convalescent plasma for treating COVID-19 patients? So I guess I'll start that to you, Jim, if you want to take that one.
Yes, we were a convalescent plasma site and remdesivir as well. And so we were able to do those. Convalescent plasma is something that has been very promising. I will tell you, our physicians have really learned a lot over the last 6 months on how to treat COVID patients. In the beginning, patients would be on ventilators quickly. We realized, the physicians realized after a period of time that it was much more effective to use high flow oxygen as opposed to intubating and putting somebody on a ventilator. So it was really a learning process, but our physicians continue to learn and get much better at treating these patients. But the answer to that question is yes, we do have the ability to give the remdesivir and the convalescent plasma.
All right, thank you. And Mark, the next one is, do hospitals' daily COVID-19 numbers include patients recovering from COVID-19 but are beyond the infectious period? And maybe you can talk about that a little bit. The numbers that we see that are presented, and they've changed, I believe, in the last 3 weeks or so. Can you touch on that?
Yeah, when we share the number of positive patients at the hospital, those are folks that are infected at this particular time. And then obviously we're monitoring them over a 14-day period of time. We have some folks that have stayed with us longer than that. In other words, have a longer length of stay, and we very well may retest those patients. I can tell you that we've had, I think, 2 patients in our history so far of patients that were positive at one time, recovered, and presented to the hospital again as positive. But that's how we count today.
Okay, great. Thank you.
And Wes, I will add to that as well, if I can, that oftentimes when you read the article in the Herald Zeitung in the morning, sometimes those numbers seem to be a little confusing. And so I can tell you that Mark and I, our teams, actually every morning report directly to the county as well. And so that's why you'll see oftentimes in those articles in the newspaper, our hospitals are taking care of X number of patients. Those are real numbers that we are reporting directly that day of patients that we have in our hospitals here in New Braunfels that day that have positive COVID. That gets a little confusing sometimes because, you can have people from the county that are hospitalized in a hospital in Austin or San Antonio. And that, can show up in the county's numbers. But what you see that when it says they are in our hospitals here today, those are real numbers that Mark and I report every morning.
And by the way, they can be the same patients. So these are not new patients. In fact, the 5 we have today, I had 4 yesterday, and those 4 of the 5 today were here yesterday. So we had 1 additional patient today.
Very good. And I do want to invite anybody, if you do want to unmute and just holler out a question, feel free to do that as well. Looking forward, so we're hearing a lot of things about the vaccine and when does the vaccine come and how many people will help. In your opinions, what do you all see as far as the vaccine going forward? What does it look like in 2021 for us?
I can comment. Yeah, I can comment first. I don't know when we'll have a vaccine. We certainly aren't strategically or operationally thinking about if and when it comes. I think we've come to accept the fact that masking may be a part of our future for a long time. I think what's more interesting is what's happening with flu. We pay attention to what's going on in the Southern Hemisphere because they experience the flu before we do. And I think you're going to see flu numbers substantially different than they were a year ago, much less. Because if you think about what we do to prevent the flu, we mask and we hand wash and social distance ourselves from others. And I think it's going to be dramatic. But I can't really comment outside of that on the vaccine.
Yeah, I would agree with Mark. We're anticipating that flu numbers to be lower this year, which is a good thing. That's one of the reasons that we're anticipating, as Mark mentioned at Resolute, our ER volumes to continue to be a little bit lower than they might typically be at this time of year because of the masking and hand washing and things will have the effect on the flu, as again Mark indicated. The only comment, Wes, I would make about the vaccine, again, I agree with Mark. We don't know if and when a vaccine will be available, but what we do know is that there will be a number of people that won't take the vaccine. And we do know that the vaccine will not likely be 100% effective. It'll be like the flu shot. It'll be effective on a percentage of the patients who receive it. And so even with a vaccine, there's still likely to be, COVID that we're dealing with every year as we have been. It just maybe not be as extensive as it has been, but a vaccine won't be 100% effective.
All right. I think you guys are probably closer to contact tracing than anybody else, but within some businesses in town, we know that we've had the spread happen from the homes, and then we have to quarantine somebody out. Have you seen spread within the hospital, or when you're dealing with it, is it usually, if it's an employee of the hospital, is it usually coming from the home originally?
When we look at the number of employees that tested positive, to the best of our knowledge, their contact with that virus occurred outside of the work setting. Initially, and I think Jim was the same way, we were pretty anxious about the number of folks out and whether or not we just had the ability to replace them. And it was fairly significant in June and July, but much different after that. If and when a person is in contact, for example, in our huddle this morning, we found out that one of our employees was in close contact. Then we asked them to quarantine for a certain amount of time, check for symptoms, and if no symptoms exist, then they return to work after 10 days.
Yeah, we manage that very closely as well through our occupational health department, and we found the same thing that Mark is referencing, that we're really more concerned about exposure outside the hospital as opposed to inside the hospital. And so that was one of the reasons that we really appreciated some of the decisions that were made by community leadership, and because we felt like that helped protect our staff when they were outside of the hospital, because they've got kids in school, they've got, have to buy groceries, all of those things that any of us have to do, they have to do as well.
All right, we had a great question from Lillian. She asked, are you seeing any changes in numbers since the schools have opened? And I guess I would expand that to even after Labor Day. Any issues there?
We saw a little bit of a...
Go ahead, Jim.
We saw a little bit of a bump last week, but ours have come back down. As I said, we only have one positive in the house today, and that is a patient who has been here with us for actually several days now. So that's good. So we've not seen that spike here in our hospital in New Braunfels, but again, we're not letting our guard down at this point.
I would say the same, and of course, we have access to the Baptist numbers as well. And probably a week ago, 2 weeks ago, there was 45 to 50 patients throughout the healthcare system. This morning, I think the number was, 54, I think. So maybe a little bit of a bump, but we're so excited not to be at 355 as a healthcare system and 35 as a hospital. Anything's good news after that.
Yes. All right, we have a question from Don Kaler. So Don, if you want to go ahead and shout out your question.
Can you hear me?
Yes, we can.
Okay, my name is Dawn Kaler, and I just want to express my thanks and gratitude for Jim and what will always be in my heart, McKenna Hospital, where I was born, and where my father just passed away in July with COVID in your hospital, and we weren't able to be with him. And I appreciate your staff taking care of my father in his last days. Wow, sorry, I didn't know this was going to come. I thought it was going to be a little more calm than this. But anyway, just wanted to express gratitude, and I'm so sorry for what our hospitals are having to go through in this time. But thanks for taking care of our community. We really appreciate it.
That's a great point, Don. And I mean, you can listen to both Jim and Mark and just know that, our healthcare locally is in great hands because of them and their staff and their leadership. So, on behalf of me as well, thank you for all you guys do. We'll finish with this one last question. There's one from Judy saying, if I present with COVID-19 today at either Resolute or Christus, what determines if I stay hospitalized in New Braunfels or if I'm sent to San Antonio or Austin? Mark, you want to start with that?
So I think if I understood the question, it was a little hard to see. Is the question whether or not I stay here or get transferred to another facility?
That's correct. Would you stay local or would you get moved?
You would stay local unless your acuity changed or your situation changed where it would warrant services that we don't provide. So by way of example, let's say there's the ultimate decision that you need open heart surgery. Resolute doesn't do open heart, so that patient's either going to move to Christus or it's going to move to Baptist in San Antonio. But we've been keeping patients for months.
Jim?
Yeah, it's the same thing. We would keep you here, and unless there was something that we didn't do, you'll sometimes hear about patients requiring ECMO if they get extremely sick with COVID. And so we would not provide ECMO here in our hospital. That's something that's done in a much higher level acuity facility, and so you'd likely be sent to San Antonio or Austin for that. But if you did not require some high level of acuity of care, then you would stay here till you recover.
Okay, well, great. Well, that brings us to the half hour. So again, thank you both for joining us. We appreciate your time. I know you're both very busy and have a lot going on. I appreciate everybody that joined in on the Zoom this morning. Just as a reminder, we do have a ribbon cutting tomorrow morning. There's going to be at 9:30, another Zoom for the Blue Coats. And then on Monday, we have our drink snacks virtual Zoom for anybody that wants to chime in on that at 5:30 Monday afternoon. So with that, from Honors Hall here, we'll sign off. Once again, thank you, Jim. Thank you, Mark, for your time this morning.
Thank you very much.
Good day, everybody.